Hello, my name is Tori Whitaker Martinez, and I'm the senior editor for Infection Control Today. And today I have the honor of having Henry Spratt, Jr., PhD, who is the senior microbiologist and professor in the Department of Biology, Geology, and Environmental Science at the University of Tennessee at Chattanooga, with me today. So thank you for joining me today.
No, it's a pleasure to be here, Tori.
Thank
And a pleasure to talk with you about another disease that I don't wish on anyone. And I hope that by learning more about it, we can prevent potential infections in the coming future, because yet again, this is one of those diseases that climate change is going to have an impact on, and if it hasn't already had an impact on here in the United States, and will probably do so in Europe and other places as temperatures warm and other conditions change that encourage tropical insects and parasites to move to higher latitudes.
Yeah, and that's a little terrifying. So, we're going to talk about leishmaniasis. What role do sandflies play in the transmission of leishmaniasis, and what regions of the world are most affected by this disease due to sandfly activity?
Well, sure. Well, leishmaniasis has been around a long time. It's not like this is a new disease or anything. It tends to be, it's noted mostly in the past as a tropical disease, mainly because the vector, which is a phlebotomous fly, these are little sandflies, small sandflies, they are typically found in warmer climates. And so there are numerous species of Leishmania that will cause leishmaniasis, and there are some that are endemic to, like, Southeastern Asia, some in Africa, some in South America, and recently there has been a disturbing discovery that apparently there is a strain, a species, Leishmania mexicana, that is endemic in Texas and part of the panhandle of Oklahoma. And so typically the way these Leishmania, it's a protozoan parasite, and it has many of the same steps that you would see in malaria. You'll see like a single cell version that gets passed to the humans, or actually one that has a flagella on it that comes from the fly, and in the humans it turns into just a single cell version that then goes throughout the body and causes various forms of the disease. There's a cutaneous version that affects your skin, and then there's a visceral version that can affect your organs. Now, so as I said, it's been studied in the tropics a great deal, but we have now found that not only is it endemic in some people, and the key is, in the past, people who would, in the United States, who would catch it, typically had a history of the last 6 months they had traveled somewhere tropical, and they brought it back with them. There is a large cohort of U.S. troops who served in either Afghanistan or Iraq. Apparently, there's a great concern there that a lot of them came back to the United States and they are seropositive. And so it's kind of interesting if you start looking at the expression of this disease in the population. There, like with many diseases, there are many people who are asymptomatic. The problem with leishmaniasis and asymptomatic patients, now it may be that their immune system is taking care of the disease and they will basically resolve it and not have any problems. However, what often happens is the parasite moves into the internal organs like the liver or the kidneys, and will do damage to the liver or kidneys in a what's called a visceral form of the disease. And those symptoms don't show up for a year or 2 years or something. So there may be no recollection in the person's mind, oh, I got bitten by this little fly, that because it happened so long ago. and they're asymptomatic. They're not showing a fever. When people have the symptomatic version, initially it shows as a fever and actually can present, if a physician is not careful in their diagnosis, they can actually say that it looks like malaria, because it looks like malaria to a degree. People are very lethargic, feverish, and so on. Now, so what's been found in Texas and the central southwest there is not only are there people who are presenting with the parasite, there is also the vector. The sandfly has been found there, and apparently sandfly is moving north. Again, this is one of those issues related to climate change. It didn't used to grow as far north, and in fact, that sandfly has been found not only in that area of Texas and Oklahoma, but also in Maryland, Delaware, and I believe in coastal Virginia, in that area, in the along the Atlantic coast. There's no evidence of there being people who are positive there, but it's probably a matter of time. So the fly is there, and the fly is what's needed to transfer the parasite. Now, you also need a reservoir for these kinds of parasitic infections to go on. And I mean, in theory, can be some transfers from human to sandfly to another human, but usually the way it works is there is a reservoir population, and in this case, in Texas, it appears to be wood rats, and the wood rats will, of course, rats like people, and they're all around where people are, so the fly bites the rat, and then it bites the human, and it has transferred the parasite to the human. So that is a big problem. Now, when it goes for treatment, so if you have the symptomatic form of the disease, you will notice it because you're going to feel bad. And if you get the cutaneous version, you get bad pustules. They're like pox. That thing that it's analogous to the old pictures of people with smallpox. And those pox they form a large pustule with a crater on the top. That's very characteristic of the cutaneous version of it. And very often, if the person resolves the disease and they get over it, they are left with bad scarring wherever they had those pox. So that's not a pleasant aspect of this. Another thing is an issue is how you kind of avoid the problem. So if you do present with symptoms, you can go to a doctor, and there are drugs that work fairly well to treat it, and that you could be done with it in a month or so of treatment. But another way of avoiding the whole problem is to avoid the little flies. And now, so that means if you're working out, and particularly for some reason, these phlebotomous flies, they like to come out and feed at dusk. So if you like to go on a walk or a run in the evening, and where they are more found, they're found in higher numbers, not in an intensely urban area, but out in the periphery, and more or less the suburbs. They like a wooded area, something like this, and they in a jungly area, in more tropical areas, that's where they're going to be found. Now, so you can, if you're going to be out there, you can cover your skin as much as you can, with clothing, and they can't bite you. Or you can use chemical repellents, DEET and things like that will repel them. In your home, though, this is the strange thing about this. And I just read up recently about these phlebotomous flies. I didn't realize, I've always heard about sandflies, and I see pictures of them, and they look like a pretty sizable little fly. They're not. They're tiny flies. They're like what I would classify as a gnat. They're that small. They are roughly 1/4 of the size of a mosquito. And so we mostly all know the size of a standard mosquito. Well, it's much smaller than that. In fact, there are some cases where these the phlebotomous flies can make their way through standard window screens and get inside your house. So that is alarming, because I'm not hearing anyone coming out with a more dense screen to put in your houses just to avoid those flies. Now, so are alarm bells going off everywhere? Of course they're not, because the number of cases in the United States is still very low. But the say from a public health perspective, the concern that as climate change continues to impact our weather events all around, and there's generalized warming, it's going to lead to more of the flies surviving the winters and then having larger populations the next year, and more of the vectors. And so we're kind of lucky, if you'll call it this, with this particular Mexicana species. The best reservoir population for it are rodents, and rats are the best examples. But some in other parts of the world, some of the other species of Leishmaniasis, or that cause Leishmaniasis, the best reservoir are canines, dogs, foxes, the coyotes. And that would be horrible for our dogs to be able to transmit this to us. And I had just read that in a study of canines in the U.S., this was in 2003, the Leishmaniasis is endemic in the canine population in the United States, with 2% of all the dogs that were tested in this study. I don't remember what the sample size was, but it was a large study. 2% of them showed seropositive for the Leishmaniasis, and the species they were looking for. And apparently a lot of those dogs develop the visceral part, so they start to have organ problems. And so veterinarians, if they're not paying attention, they may diagnose the dogs and give them some other treatment that will not work to clear this protozoan parasite. So anyway, that in a nutshell is the new concerns that you may be hearing about online, in particular, for these parasites. It's something to look out for in the future, and apparently, if you know that you're living in one of the areas where it's endemic, or and maybe you've even seen some of these sandflies, to take precautions and wear longer clothes, or spray a deep, insect repellent on your clothing to keep you clear. That's a good recommendation, I think.
Yeah, that was going to be my next question is it found in other mammals besides rats? Did you read anything else besides dogs as well?
Oh yes, so depending, and so with different species around the world, some of them, monkeys are the main reservoir. Let me see, I have made a list of some of the reservoirs that we have here. Right. So in Central America, now this is a different species. There's one that the hosts include dogs, foxes, and cats. And that's a pretty standard mix around the world. It's either canines or rodents or monkeys. And so if you live in a place where any of those kind of animals are living out in the natural areas, you would be potentially should be concerned, particularly if there are sandflies there as well.
Yeah, I mean, we all do. You know, most of my friends, we all have cats, we all have dogs. Of course, I live in Ohio, so we don't have that problem yet. But, as we spoke earlier, Maryland's only 6 hours from here.
Yeah,
And,
yeah.
we may
And
not have to worry about it now, but maybe we will.
one concern I know that epidemiologists have with particularly the cohort of the troops that came back from Iraq and Afghanistan, apparently and I don't have the numbers to tell you what they were, but they showed seropositivity in a large number of them. Now, there has been some debate as to whether a bite of a sandfly on an infected human could then go and bite a rat or something, and then transfer the parasite there. I don't know that form of the transfer occurs, but see, the problem is somehow the rodent populations in Texas have now become it's endemic in them, And that's what starts, that's the basis for the parasite being able to be spread to humans.
Well, this reminds me of malaria because now malaria is endemic too in like Florida and Texas, I
There are
think.
parts of Texas, exactly. And one of the things is yeah, I might have mentioned, I don't know if I mentioned this or not, but the symptomatic form, very often people who are showing the symptoms are misdiagnosed with having malaria.
Yeah.
I don't know if the malarial uh, quinine, I forget what the drug is. I think it's quinine, um, to treat malaria. If that would affect this parasite, because it's another protozoan, and it may be that it has an effect. But amphotericin B, I believe it is an antibiotic that does work. Yeah, it's amphotericin B, yeah. And then there's some other, uh, let's see, the standard treatment for the leishmaniasis is a drug, and I cannot, stibogluconate. Stibogluconate is a very common treatment for people who are showing the symptoms. But again, the problem is the people who are asymptomatic, and they're asymptomatic because the parasite has gone internal, and then it can be deadly. I mean, it has I don't know what the mortality rate is, but it can be deadly once it resides in the organs long enough.
It just seems like we have more and more things to worry about. You know, it,
Well, so yes, climate change is impacting it. There are other socioeconomic factors that come into play that, particularly in other countries where you get people more crammed into areas where the density of human population used to be lower, but then they'll have animals around them who serve as the reservoirs. And so all of those sort of things come together. It's one of these perfect storms where these things are starting to come together. And that's where in the US, with the strong public health systems that we have, if and we're seeing this at the beginning of what appears to be a change, that it's shifting from the tropics now to more temperate areas, that we should be able to come up with, like public health, make sure that all doctors who diagnose it report this disease. And apparently it's not, and that is generally left up to the state public health. In Texas, it is leishmaniasis is a reportable disease, and so there is data coming in on that. But apparently in Oklahoma, it is not yet, and I don't know if it's changed. As of 2021, it was not a reportable disease, and so it's not reportable anywhere else. And since they found the flies in Maryland and Delaware, it seems like they need to be reporting that as well.
yeah, because it could be other places we just don't know.
That's right. And, I mean, if, and I don't know, I don't think we're going to start testing the general population who would stand for that, giving blood to have the serotyping to determine if people have the antibodies against this. And currently there's not a vaccine. I mean, and so that is something, a route that we may, if we start to see that it is really moving in to the United States, and we're starting to see many more cases, then it would be about time to start the process, because there are enough people around the globe that could benefit from a vaccine. Sad to say that generally they're in poorer countries. The United States, if it affects a small population of us, we're going to make that vaccine. So, but I think if maybe that will be the thing that will start the process to make a vaccine that could also be shared around the globe. The issues we start to run into there is that there are different species of the parasite, so you may need different types of vaccines to get all of them. So there's not just like one shot for all of them. But anyway, those will be future concerns and questions that will have to be asked and answered as we move ahead.
Well, do you have anything else you would like to add?
I think the one thing that I found in common with a lot of the people who contract this disease is particularly in the tropical countries, very often they're malnourished, they're they're ill for some reason or another. They may have chronic other parasitic diseases. So if you can keep yourself healthy as best you can by eating well and exercising well, that tends to sort of strengthen your immune resolve and your immune system. And so you're going to have a better chance of being able to, just quickly get over one of these infections if it does happen to you. But then also watch, if you get little bites and you start to see unusual, like pustules or things on your body that, well, there was a little fly flying around me there, keep an eye on it. And then if you start showing any other of the symptoms, like if you ever run a fever or you're feeling very ill and lethargic, talk to your doctor.
Yeah, and don't wait.
Yeah, don't wait. And then if you have to work outside, or if you do stuff all the time in the twilight hours, dress more to kind of keep the bugs off you and use insect repellents.
Yeah, just like mosquitoes or anything else. There's so many things that we should, be careful about. And the list is getting even longer.
So
So,
it's just getting even longer. Exactly.
well, thank you so much for joining me today. This has been so interesting. Leishmaniasis is not something I'd ever really heard much about. And so I appreciate it very much.
Well, you're welcome, Tori. Thank you for talking with me.
You're welcome.